Okay, so here we are. I'm Jonathan Fisher,
I'm Aiden Seraphim.
and it's the show. It's your go-to show for health and wellness.
Yes, it is.
Today, however, it is all about you. Yeah,
All
we
right.
are. I'm going to interview Aiden about acupuncture. So we're going to find out all the things you didn't know that you wanted to know today. However, if you do have any questions, ask us. We'll answer those questions on other episodes. But today it's all about you. So let's get the ball rolling and find out about acupuncture.
All right.
First of all, the name. First of all, acupuncture. So you're going to accurately puncture me.
Wow, man, I never thought about it that way. But
That sounds like it might be painful.
Hmm.
So right off the top, I think this is what some people might be concerned about is, although I will say I'm not, but I'm pretending that I am.
Okay.
All right? Is the needle aspect. When I'm thinking needles, some people might think, oh, well, they don't like shots, they don't like their blood drawn, and now you're going to stick 1,000 needles in me. How could this possibly be something that would be good for me, that wouldn't be excruciatingly painful? It's like a reverse bed of nails, that they're all these needles in me. Is it painful? Tell us about that, because it sounds, I think, to some people like it might be excruciatingly painful.
Well, Jonathan, this
Yeah.
is a very common fear
I would think.
or misperception, oftentimes with people when they hear about acupuncture. And the truth is that the needles that are used when we perform acupuncture are very, very different from the needles that are used when you get your blood drawn when you go to the doctor. And the main way that they're different is that the needles, when you get your blood drawn, have a hollow center, which is where they either take your blood out or they inject you with something.
Right.
The needles that we use are called filiform needles, which means that they do not have a hollow center. They're 100% stainless steel, sterile, one-time use only needles.
Okay.
And they are literally hair thin. They are extremely thin needles. And depending on what's going on in the condition that we're treating, they can vary in size or gauge, it's called.
Okay.
And so the other question is, does it hurt? Well, to be honest, for some people, yes. But not the way that you would think it does. And also, I like to make the analogy because I just started working out at the gym again recently.
All right.
And at this awesome gym actually called Fitness on Fire in Irvine, they have the most incredible attitude.
And they just get a free
and
plug.
positive environment. So I just want to throw that out there. But so I started working out again, and I haven't been doing it for a while. So we did a lower body exercise on Tuesday. And for the last 3 days, I have been in excruciating pain.
Okay.
You know, so getting up and down and walking up and down stairs and even just like
Right.
walking down the hall at some points has been very painful because I was using muscles that I haven't really used for a long time.
Yeah.
You know, and so in the beginning, it's kind of painful. But I know that because I have been somebody who's worked out a lot in my life, starting from when I was a kid, that once you get through that initial painful period of the adjustment that your body is making, it's not like that when you go forward. And so I know what the benefits are, and so it's worth it, if that makes sense. So
Okay.
if you think about it like that, I think that anything that really sort of produces a meaningful, significant impact in our life comes along with a little bit of pain. Because it takes us outside of our comfort zone.
Yes, which I love that topic.
So that's a different topic, but anyways.
Yep.
So yes, so
Okay.
sometimes on some points when the needle goes in, you'll feel like a slight pinch.
Okay.
But usually that very slight painful sensation will disappear very quickly. And then as the needles are in for a period of time, you'll feel sort of like this pinging between the needles as the body is starting to rebalance itself. So they'll sort of like, or maybe you'll get like a warm sensation around the needle. Sometimes they'll be achy. And there are occasions when we will get right up next to a nerve or something. So you might initially get like just a slight zing. but then that will go away.
Okay.
So these are all just very short sensations, and so generally overall, and there's a lot of points that don't really hurt at all. So
Okay.
it's very dependent on what we're doing, what's going on in a person's body.
Are there parts of the body that are more sensitive?
Oh, absolutely.
Yeah. Okay.
So
that's what I figured.
anything that's like near the hands and feet tends to be more sensitive,
Okay.
because there's not as much tissue, right? So any area that there's
Less
not as much tissue
meat
that's next
on
to a
it.
joint
Okay.
tends to be a little
Okay.
more tender at first. But like I said, these are like very passing, fleeting sensations, and the effects that you get after you have sort of sat with the needles for a while way outweigh that tiny moment of pinch.
Well, and because I do work with clients on pain issues as well, sometimes I'll have a client like pinch themselves, saying, if they're wondering what the feeling of pain is, if I'm working on fear of needles or hypnobirthing or something. It's like, you're not that giving birth is the same as pinching your skin, but we're just talking about pain. But I'll have them like, oh, it'll feel like this, or we'll test some anesthesia and we'll like, can you feel that? Because a lot of pain, I think it's like 60% of pain is mental.
Right.
So if you can remove that, you've decreased even the little bit of pain they're feeling by a significant amount.
Well, and you make a great point, because I think actually what leads to a more painful experience is when we tense up and we have the fear and anxiety component of what's going to happen.
Yeah.
And so I also will use with people breathing and distraction techniques that are super effective. So if I'm going to be using a point that tends to be more tender, I'll have somebody take in a breath and then exhale really hard. And I'd say, 95% of the time, they don't have a painful sensation, because it's that distraction, the mind, that helps them sort of bypass the pain.
Well, how many times have we, been doing something, we get a paper cut and it's excruciating, and how many times have we noticed that we had a paper cut, like, when did I cut my finger? The exact same cut, but because you were distracted, you're doing something else, zero pain.
Right.
So it really is what you're putting onto the event.
And then to also sort of add on to that, on the other side of that question, like further down the road, is that one of the most amazing things about acupuncture, as far as the evidence goes, is that it's really effective at treating pain.
Right.
So you might get a temporary sensation of pain. It doesn't happen all the time, and not for everybody, but if it does, it's producing an effect in the body that is allowing your body to release its own opioids or pain-relieving anti-inflammatory chemicals, to go to an area and sort of clean it up. And so the long-term effects of that slight pinch are way outweigh,
Absolutely.
Does that make sense?
Okay, so now maybe some people have the image in their mind that, I'm going to go and I'm going to be covered in needles, like hundreds of needles on me. Maybe they think that they're like a pin cushion.
Well, I think sometimes we've seen in the movies, some scenarios that are like that.
So how many do you usually use for a typical
it
whatever?
really depends on what's going on with a person. In Chinese medicine, which is the umbrella under which acupuncture falls, there's a lot more modalities that we use than just putting needles in somebody. But we're always assessing, a person's state of yin and yang balance, and the balance within their organ systems. And so if somebody is more deficient, right, meaning that maybe their vital energy or their blood or, other substances in their body is weak, then we're going to tend to use less needles on that person.
And how do you determine that if it's...
So we determine that by feeling somebody's pulses, and by looking at their tongue, and sort of assessing also their symptoms. We can tell it by palpation. There's a lot of different tools for diagnosis.
So when they're in the office, you're doing those things, and then helps you gauge like not only what you should do, but maybe how many needles.
So if somebody's like super robust, and their main issue, like you, man, and their main issue is that they have a lot of stagnation in the body. Right? Like, then I might use a lot more needles.
What's the fewest on a given thing you might use, and what's the most you've ever used on a human being?
The fewest I've ever used is 2.
Okay. Where can let me guess? The ear.
That is one area.
Where did you use the 2 that you're thinking of?
On a point called Shen Men, which is a spirit point. It
Okay.
is associated with not only helping to sort of relax the nervous system, but it's a huge point for pain
Okay.
in the body. So sometimes that has been the case, but mostly
So-
it's a point on the legs.
So 2, but what we really want to know is what are the highest number of needles you've used on one person in one session?
Well, probably when I was practicing facial rejuvenation acupuncture,
Oh, really?
which actually helps to stimulate the body's natural collagen production. And so you use it on the face. But then you also, because in Chinese medicine, we're constantly, as we've talked about before,
Yep.
looking at the root and the branches.
We're going to
And
use this tree a lot. I
treating
think.
both of those, right? So I want to help alleviate somebody's symptoms, but I also want to help address the underlying imbalance, right?
Yep. Well, okay, on that actually. So when let's say somebody's coming in for pain, you said that's
Wait,
one thing.
hold up one sec, so
Yeah,
I don't
yeah.
forget about the
okay, yeah.
highest amount, the number.
Yeah. Oh yeah, we gotta get that.
So probably that was somewhere around 30 to 40.
Were they all on the face?
No,
Okay.
that's why I see we're addressing the
Okay.
whole system
Okay. So
itself.
how many were on
and
the face for the rejuvenation?
And these are like really, really tiny intradermal needles, a lot of them, and also very fine, thin,
Yeah.
high quality needles because we're dealing with somebody's face.
Yep. You're visualizing on my face right now.
Yeah, I'd say
Like you're
like
counting.
maybe 15 to 20
Okay.
sometimes, not always.
See, when I think of, because I'm playing the person who's afraid of it, but because I've had every kind of, I've had my blood drawn hundreds of times. I just had it 2 days ago. So like when I think of like needles, to me that sounds great. I'm like, cool. It's like really getting at that itch I want to scratch.
I just had a patient the other day
Yeah.
who loves, so when we insert a needle,
Yeah.
we try to like feel down into the tissue to get what's called the chi.
Right.
And
Do you
that,
spin it a little bit?
a little bit, yeah. And so what that feels like is kind of like a fish that's biting the end of a hook. So you feel the pull or the connection of the needle to the body. And so that's what we're constantly looking for. For patients who are super sensitive, I usually don't do that. I like to do that because I think it provides a more powerful effect because I'm really making those connections. But I have some patients who love that really strong sensation.
Yeah.
And they just want more and more of it. So like I can just stimulate that needle
That's a whole
and
other
they're like
story, I think. There's something else maybe going.
masochism a little
yeah,
bit.
it's the Steve Martin character in Little Shop of Horrors, but
Well, just to feel the body.
Yeah.
Like I think for a lot of people who are not embodied, sometimes that sensation that brings them into their body.
Yeah. It gets
But
more
it's
connected.
I mean, I had another patient the other day who experienced sensations that were foreign to her and her body when we started working, and that actually induced a lot of anxiety.
Right.
So I'm always having to walk that fine line, and that's why we always talk about the importance of treating the individual.
Yep.
And so we take a very focused individual approach to every single patient that I'm working with.
Right. And obviously because anxiety is going to come up, you're familiar with that, you would know how to handle that.
Right. And at the end of that session, that patient that the anxiety came up had some incredible insights and breakthroughs about what that was about. So
I would guess it's a little bit like massage in that, like, if I'm getting a massage, I like the more gentle, like Swedish massage, but I have friends who like they want a deep.
I love the deep
Yeah, I
massage,
don't
man. I'm
like
like,
that.
just get as
Yeah.
like make it
I don't like
hurt,
the
you know.
yeah.
I like that.
That's too much. Like I would sometimes I wouldn't mind them like hitting me sometimes, but like the digging I don't like. Like sometimes if they could like punch me.
See, the
That
really
would be good.
soft type of massage
Yeah.
kind of irritates me.
Yeah.
And I'm like, okay,
Totally,
all right,
yeah.
you're not really doing anything here. I need you to like get in there and
Right.
break that stuff apart.
Yeah. No, I totally
So
understand.
everybody's different.
Yeah. So and you're getting that in your practice. So okay. We got that, and if you have any more questions about specific things, absolutely address them and ask us. Okay, so Chinese medicine. looking at the tongue, feeling the pulses. People might think, well, this sounds very woo-woo and weird and whatever. I'm going to answer this quickly. I'm going to answer my own question briefly.
Okay.
First of all, like what you said about checking the pulses, checking the tongue. Well, Western medicine does that. I mean, how many times do you have to stick out your tongue and check your pulse? I mean, they've checked my dorsalis pedal pulse, which sounds naughty, but it's actually just the pain in the top, or the pulse in the top of your foot.
Well, usually when you stick your tongue out for a medical doctor, they're actually looking at your throat and the whole oral cavity.
Right.
So
but it's still
different,
looking at
yes.
coloration. It's still looking at things. So they're not doing things that are so dissimilar than what you're doing.
Right.
However, it's Chinese medicine. It's acupuncture. That's weird, and that's what they might be saying.
I mean, it is kind of weird. It's a little, to be honest, you know.
But it's been around different. For how long?
I mean, we classify things that are different as weird. Yep. So if we're using that as our sort of like measure, then it is a little bit weird, right? It's outside of the norm.
Well, as would Western medicine be if you were like, all we're gonna do is we're gonna cut you down the chest and spread it open and go. It's like
that's kind of weird too.
That's kind of weird.
Right.
It's completely non-invasive.
Right.
Okay. Yeah. So address
a couple
the weirdness
of things.
factor.
So it's actually really cool because there is a whole science to this diagnosis process. And what's so amazing about it is, so when you go to your doctor, they are feeling your pulse. Usually they're feeling it for rate and sometimes for like any type of irregularity.
Yep.
And then, you know, like I was saying, when they're looking at your mouth or your tongue, they're just sort of checking the whole oral cavity to make sure that you don't have like cancer or, you know, something that is inflamed, you know, or concerning to them. But when we feel the pulses, each pulse position, and there's 3, 6, 9, 2, 6. There's 12 pulse positions total. Jesus. Anyways,
I think yours just went up thinking about that.
The reason that I got kind of caught up right there is that, so on each side there's 3 positions, and within those 3 positions there's 3 layers. So there's a whole multitude of things that are going on and things that we're feeling for. And then with each position, it's associated with 2 different organ systems. So for example, on the left side, we have the heart and small intestine on the front pulse, the liver and gallbladder on the second pulse, and the kidney and bladder on the third pulse. So we're feeling for, you know, not only what's the condition or the strength of each of those organ systems, but what is the balance of yin and yang within all of those organ systems? And then what is so a healthy pulse would be a pulse where there's a nice consistent flow throughout all 3 positions, and a nice supple quality to it. Like it's not too full, it's not too thin, you know, there's like there's a good quality to that.
Okay. And when you're doing that, that determines what? Like where you're putting the needles, what needles you use, what is that telling you?
Well, so just to finish it off, on the right side, you have the lung and large intestine, the spleen and the stomach, and then the pericardium and the triple warmer. So what that's telling me, what's so great and amazing about this is that it's showing me any area in the body where, so all of our organs have relationships with one another, right? They need to be able to communicate and work together in order to allow us to be healthy, essentially, right? And so we can identify through the pulse when that relationship is disrupted, when that conversation and connection is not happening appropriately. So basically, everything starts off on an energetic level before it manifests on a physical level, which means that through feeling the pulses, oftentimes we can feel physical issues before they even manifest, which is amazing. That
is amazing.
You know, it's truly preventative medicine in that sense, you know?
Yeah.
And then the tongue is very similar, you know. It's, I think, more like immediate. It's more in the way that I use it, showing me that balance of yin and yang really clearly in the tongue, because the tongue should have a certain shape, a certain color, a certain coating. And so there's also associations with different organ systems in different areas of the tongue, but also like depending on, how thick or thin or how thick or thin the coat is of the tongue, it tells me the balance of yin and yang.
So would you say that the pulses are a little bit like a predictive thing and the tongue is more of a present state kind of diagnosis, sort of?
I mean, it's more complicated than that, but
I would imagine,
you could lean in that direction of understanding.
So you're looking for a lot of things. How long has acupuncture been around?
So Chinese medicine and acupuncture has been around for over 2,000 years.
Happy birthday.
And this is also a great introduction into the science behind it, is because, they came up with this medicine before we had any of our modern technologies, right?
Right.
And so they made these associations, sort of knew where the organs were and all of that, simply by observing nature, observing themselves in nature,
right,
meditating, and, sort of visualizing the flow of the energy through the body and how all of that worked, right? They came up with the meridians, all of the acupuncture points through that, right? And then also through, I would suspect, some trial and error of testing things out. Well, 2,000 years later, we have these like modern technology imaging machines, and two things that really stand out for me are, so in Korea they were doing these studies, and they were using high electron microscopes to look inside of the blood vessels,
right,
and they noticed that there were these tiny little filaments that weren't associated with anything that they had discovered before.
Right.
And they're like, well, what are these? And then they like looked throughout the whole body at these things, and they discovered that they actually lined up with the meridians.
Really?
So that's one. I mean, that's pretty flippin' mind-blowing.
Wow.
And then the other is that they have done a lot of studies where they will needle a specific point on the body. Stomach 36 is a point that they have done a lot of research on.
Mm-hmm.
And then they'll do a scan of the brain as they're needling that point. And what they find is that an area of the brain will light up that's associated with the function of that point.
So they're probably doing like fMRIs while they're doing acupuncture.
Or PET scans, yeah. And so what's so fast, for example, stomach 36 is a point that's used a lot for any type of abdominal, stomach, digestive sort of issue.
Right.
And the area of the brain that lit up was the area of the brain associated with gastric functioning.
Wow.
And then they will put a needle outside of that area of the point, and nothing happens in the brain. It doesn't light up that area.
So they have to be very accurate in their puncturing that spot?
There is a sense of that, yes. I mean, accuracy is important, but then also you have to be energetically aware, because every person's body is different, right? So you have to first know accurately where the point is, and then you need to be able to feel where the point is, because for some people, their anatomy is different. Right. So it is kind of this balance between both of those, accuracy and sensitivity.
Well, I think this is just my own opinion, but going back to how it began, the 2,000 years ago, I think that there was probably some trial and error, but I think it's also what you're saying as far as it's an individual connecting to another individual. So I think although the trial and error is there, I think a lot of it was this intuitional thing that was going on. Yeah. So you didn't have to just try everything to find out what worked. You were more guided by I'm hedging my bets. It feels like it's this. It feels like it's that. And it's sort of
it started first though before any of that happened, it started first from those individuals deeply exploring their own anatomy and terrain. So that's what I started with by saying, by emphasizing their connection with nature, spending time communing with nature, observing nature, spending time in meditation with their own bodies in nature, reflecting on how there is a connection between all of it, right? And in Chinese medicine, there's this saying that how do you, when they're put on the point, on the spot. I've been coming. Yeah, that's yesterday. Okay. I said this thing. I said it's just the tip of the berg. So I'm creating these.
It's just cool. It's the new. It's what the kids are saying these days.
But basically, we are in the universe, and the universe is inside of us, and that there's a direct relationship between the microcosm and the macrocosm.
Yeah.
Right. So you will find within the macrocosm the microcosm and vice versa. Like there is this inseparability, this
the holographic
connection,
universe.
Exactly,
Yep.
between everything.
Yep. Okay, so learned a little bit about the history and kind of the process. What are some of your like success stories that you could talk about?
Wow. So
And then also maybe not just that, but maybe first, like, what are some things that you've mentioned pain, but what are some things that you would actually use acupuncture for? And then give examples of success stories possibly for those things.
okay. So I want to start off by sort of saying two of my main success stories, and then I'll talk about some of those conditions
Yep.
and address that.
Yep.
Because I think that this kind of reflects how Chinese medicine and acupuncture can benefit the beginnings of life all the way to the endings of life. When I was in school, I worked at a place called the Immune Enhancement Project, and we treated a lot of people with autoimmune disorders and serious conditions like cancer.
Yep.
And I had this wonderful woman who was in her late 80s who had colon cancer. And so I treated her through my time there. I think I was at IAP for like 3 of the 4 years that I was in school, and I did my internship my last year there. And so I developed this really strong bond with this woman.
Right.
And she was, going through treatments and stuff, and acupuncture was really helping to alleviate the symptoms that she was experiencing as a result of chemo and radiation. And so when I graduated, she actually wanted to follow me into my private practice. And so she got a hold of me, and she came in, and, due to her age and some other factors, the cancer had spread so much that she was at the end of life type of
Yep.
part of treatment. And so she went into hospice, and she actually had me come over to her house, and I went through this process with her where I actually used very few needles, mostly essential oils. I did use some acupuncture points, but then just presence and breath, and guiding her, through this, because for her in the beginning there was a lot of fear around the death process, like there is for most of us.
Right.
And so I was really able to sit in that with her and walk her through that, so that by the time she did pass, she was like really like at ease with the whole thing. She was ready to go.
Wow.
And it was so powerful for me. It was probably one of my most powerful experiences using this medicine, because I got to become close with her family, and then I got to be in the room after she had passed away, and we did a ritual to honor her. And then her daughter actually started to come see me to help her process through some of the grief that she was experiencing as a result of that loss. So that's on one end. And then on the other end, I have had the opportunity to help women who have struggled with infertility. I had 3 women come to me, which was quite bizarre, all in a row.
Really?
When I was living in Massachusetts, and all of them were
Did they know each other, or just
No. Just
for some reason all of a sudden the universe is like, this is what you're doing.
These type of people.
Cool.
And I loved it, because I had the experience of a friend in college who got pregnant, and I helped her through her pregnancy, and then induced her labor, and then treated her in labor to help her address some of the fear, anxiety, and pain she was experiencing.
Yeah.
And then after that experience, her daughter, who is named Lucy, and I have been really deeply bonded.
Wow.
And there's just a connection there that's so amazing, and it makes me so happy. So I love that.
Yeah.
And I love babies anyways. I used to hold babies in the NICU. I wish I could do it again. So if anybody knows of a place that's looking for volunteers to hold babies in the NICU, please let me know. But
it's the circle of life.
Anyways, so these 3 women came, but the reason that they were experiencing infertility was different for all 3 of them.
Okay.
Which is what makes this medicine so powerful. So one of them was a high-level woman who was a project manager, and she was just overwhelmed by stress. And this was what I think was really interfering with it. So after about 3 months of helping her, develop techniques to manage her stress better, helping her body release some of that stress and rebalance itself, she got pregnant. And then there was another woman who had an autoimmune disorder that was making it difficult for her to get pregnant. After working with her using essential oils, nutrition, and acupuncture, she was able to get pregnant in about 3 months as well.
Wow.
And then the last woman, she wasn't getting pregnant, and I discovered that it was because she kind of had a thought in her mind that she didn't want to get pregnant.
Oh, well, there you go.
So we addressed that and cleared that away because there was some fear about, having another child.
Mm-hmm.
And once we worked through that, she got pregnant.
Wow.
So I love that, being able to, work through the whole spectrum of life experience. So
that's great.
But then as far as which conditions, the World Health Organization put out a statement, I think it was like in 2003 or 2005, that after they had done a lot of research around, acupuncture, and they determined that there were conditions that the research really supported that acupuncture was absolutely effective in treating.
Yep.
And then there were conditions where the research really supported it, but they wanted more research. And then there were conditions where there just wasn't enough research yet.
Right.
So the conditions where there was overwhelming evidence that acupuncture is effective were things like allergies, allergic rhinitis, things like low back pain, things like shoulder pain, nausea and pain associated with chemotherapy and cancer treatment. And there's a few more that are not coming to my mind right now, but I have treated a lot of patients going through cancer treatment, and that has been super effective. But so this whole pain thing. So I had this patient also in Massachusetts who came to me because she was experiencing this leg pain that she had gone to an osteopath, she had gone to a general practitioner, she had gone to, I think, like a yoga and massage person and a chiropractor. Did I already say that? Anyways, I think she went to, when she was at the osteopath, he recommended that she get acupuncture. So she came to see me. And it took about 5 or 6 sessions. But what I identified was that there was a huge amount of relationship issues that she was experiencing that were going into the leg pain. So I treated the leg pain and those simultaneously.
Which leg was it? Do you remember if it was the left or the right?
Oh boy, I don't.
Okay, well,
there is information in that, but I mean, I don't remember that right now. But anyways, that's really what I love to do the most is work with people on the intersections of these unprocessed emotional things with their physical discomforts, because there's such a strong connection. And if you treat both of them together because of the mind-body connection in this medicine and in reality, like we're able to address both simultaneously, and then this magical thing happens.
Okay, I have a question about so whatever it is that you're treating, are you treating the symptom or are you treating the cause, or both, would you say? Or does it depend on what they're coming in for?
I almost always treat both.
Okay.
Simultaneously.
Okay.
Sometimes though, like for example, I had a patient come in yesterday and she's been experiencing a lot of hip pain, but the kind of root underlying emotional issue was so prevalent and so important to address in that moment that I didn't treat her hip at all, and we only went to the root. So sometimes, I mean, mostly that's what I'll do. I'll either always treat the root a little bit and the symptoms, or if it's so prevalently important that I go straight to the root and only the root, I'll do that.
Okay.
But even doing that provides some alleviation of the symptom.
Oh, absolutely.
So.
If not immediately, certainly soon.
Right.
Okay. So somebody's watching this and they're saying, wow, that sounds really interesting. I have Western health insurance. I don't know an acupuncturist, or maybe they don't live near here, and so they can't go to you or whatever. What is their next step? So they want to try it. They maybe want to work with their doctor as far as getting a waiver or whatever to talk. Well, what is the next step for them? How would they go seek one out? What should they do?
Well, I mean, I think what you said in one of our last episodes is really important. I suggest that if they really are interested in trying it, that they go to their doctor and say, I'm going to do this.
Yep.
Can you give me a referral? Or, because sometimes with certain insurance carriers and stuff like that, if you get a referral from your doctor, they'll cover it for more sessions and stuff like that. I personally don't deal with insurance companies. it's a big headache and very, very difficult.
I can't imagine.
And so what I offer people is the option to, either just pay by cash, use their health savings account through insurance, or FSA. Isn't there's a health savings account and there's another one that they can use for health related stuff.
I'm not sure.
Or I will give them a super bill that they can then provide to their insurance company for partial reimbursement.
Okay.
But there are a lot of acupuncturists out there who will take insurance. So you can always, contact your insurance company and ask them, or, just sort of seek out.
Yeah, and I think so too. Like we talked about before, where tell your doctor you're going to do this. Maybe he or she has a recommendation. Great, you go with that. If you know someone, or ask around, ask your circle of friends. Maybe they know someone they can recommend. Go from there. But yeah, tell your doctor, get him or her involved, so that it starts that process of them thinking, hey, maybe I should bring this up, or maybe I should learn more about this, so we can all kind of come together and use these services.
And then I definitely, on the other side that I haven't addressed yet, is that I definitely recommend that they ask their doctor if they're willing to share information back and forth between them and the acupuncturist.
Yeah.
I get a lot of referrals from psychologists because of my emphasis on the mind-body connection. And I always, sort of talk about, with the permission of the patient, sort of our approach together with that person, so that we can, be the most successful that we can be working together.
Well, and I obviously I would totally agree in that is how we change everything. Because when the two professionals are talking and you're involved in that conversation, everything opens up, and it's like, hey, we're all on the same side, which is improving that patient's health. So
absolutely
cool. And now, if they wanted to have more, get more information, like, I wonder if Aiden, if you work on this or that issue, contact us. You can contact Aiden. You can leave a message here, and in fact, maybe also do that. We do both. You can pose that as a question, and you can field it in the comments section, so that everyone can benefit. If there's a topic you want to hear more about, we can do that as well.
So this is only the tip of the berg.
It's the tip of the berg. Again, all the kids are saying it. So it's the new term, right?
And then next week, we will be interviewing Jonathan about what it means to be a hypno coach.
Yeah.
Wow.
What is that? That sounds crazy. We'll learn about that. If you have any questions for that, you can ask in advance. Otherwise,
awesome.
That's it.
Well, thank you, Jonathan.
Thank you for telling us about acupuncture.
I hope that I have provided a little bit of an opening for people. And if they're interested, I encourage them to explore it further.
Very good. All right. Thank you so much.
All right. Until next time.